For the first time, a health panel in the United States has recommended that adults under the age of 65 are routinely screened for anxiety disorders. The change follows a pressing mental health crisis that's unfolding across the country.
The GP, Dr. Brad Mackay, joins us now to talk about this here. Brad, how would routine anxiety screening work?
Yeah, so this is screening the general population, so people who haven't been diagnosed with anxiety. And what they're planning to do in America is, as people are going to see their general physician, having a screening questionnaire. So ticking the boxes and then seeing if you would be fitting in with that diagnosis of anxiety.
OK, so the study found the median time for initiating treatment is 23 years of age, or 23 years? 23 years?
Yeah, from the start of anxiety to having it diagnosed.
Why is it taking so long?
Yeah, it's a very long time. So people will often live with anxiety for ages and they won't actually realise that they're suffering it. They just think that anxiety is normal. And it's really really exciting when we treat it with talking therapies or with medication and people actually start feeling normal for the first time in their life. They're able to get rid of that crushing chest pain that they've got in the middle of their chest and throat, having difficulty communicating with other people. They're actually able to improve their work productivity. They're less distracted. They're able to concentrate. Their family relationships work better. There's so many sort of benefits from actually treating anxiety.
Well, it's also about how we talk about anxiety and how we talk about people who are experiencing it. We tell them to toughen up and we tell them to, you know, come on, get on with things and, you know, you've got to get on with it. That sort of narrative has to change too. So let's say we adopt this approach here in Australia. How would we do it, and would it be beneficial?
Well, I think if you're asking GPs across the country to do the screening questionnaire, my anxiety will be through the roof. So we're already stretched at the moment.
So who should do it?
Well, sometimes they are bringing in sort of screening questionnaires in the waiting room, so people can go on an iPad and sort of like answer the questionnaire while you're waiting for a doctor to see you. Also, we do have Beyond Blue website as well, so you can go there and do a screening checklist.
I guess I'm sort of thinking about how, if we are going to sort of make this happen on a level, maybe this should be from a federal level, maybe this should go through Medicare or the MyGov website. There's something we can actually gather the information of and be used properly for this country.
Yeah, well, the other issue
as opposed to just like, I appreciate what Beyond Blue does, but they're an organisation not be able to action things unless...
Yeah, so it's back on the individual to take action. Sure. But the issue here in Australia and in the States is that access to healthcare is terrible. So if you're diagnosed with anxiety and you need to see a psychologist, you could be waiting for 6 or 12 months at the moment to be treated.
All right, we also want to ask you this morning about burnout. There's a lot of discussion around burnout at the moment after the pandemic. While it's not a medical condition per se, what are the hallmark signs though to look out for?
Yeah, so burnout, it's a prettier name than a complete nervous breakdown, which is how we used to talk about it. But it's a state of complete sort of physical, mental and emotional exhaustion. So, a lot of people are sort of experiencing this at the moment. And, there's fatigue, insomnia, being like unmotivated to do anything at all, a decreasing sense of accomplishment, just feeling helpless when you're in the workplace. And it's just this sort of like, it's a bit of a snowball. It's sort of like gathering speed as you go.
I feel like this is a snowball. I feel like we are starting to talk about things now as a society and normalise behaviours as a society, which is so important. Anxiety, burnout, and the discussions around it is really important. Dr. Brad, thanks for coming in.
Thank you, Brad.
If this has caused concerns for you or anyone you know, you can contact Lifeline on 13 11 14.
G'day, it's Ali.
And Karl.
Thanks for watching the Today YouTube channel.
Subscribe now for brand new videos every day and exclusive bonus clips.
Ali, say please.
Please? Why?
Please? I don't know.